Hi everybody, this is the last PowerPoint for this course. In this PowerPoint we will talk about special senses. The ear has two special senses, hearing and equilibrium. So let's talk about what we see here. There are three parts to the ear: an external ear, middle ear, and inner ear. The external ear has three components. The pinna or auricle makes up the outermost portion of the ear. The purpose is to collect sound waves and channel them into an ear canal. This tube here is called the external auditory meatus. It is literally a canal that travels into the temporal bone. I'll go ahead and label temporal bone here. And of course here. So there's earwax that is produced by that external auditory meatus to help keep objects from getting further down into the ear canal closer to that tympanic membrane. That earwax is supposed to be moved automatically to the external portion of your ear, thus rendering its removal typically unnecessary. The final portion of the external ear is the tympanic membrane. The tympanic membrane is simply the eardrum. Its job is to vibrate with sound waves. Those sound waves will then travel into the middle ear next. Let's now talk about the middle ear, which is an air-filled cavity inside the temporal bone. There's a canal that you see here called the eustachian tube, sometimes called auditory tube or pharyngotympanic tube. And that term means throat tympanium tube. Okay, so then the purpose of this tube is to equalize pressure on either side of your eardrum. If you've ever been to the mountains or flown in the airplane and had pressure build in your ears, it feels like someone is pushing on your tympanic membrane. Yawning or pulling on the earlobe can help to equalize pressure by opening up that tube. Now, in little kids, this tube lays more horizontal, making it easier for bacteria in the throat to travel up the auditory tube and into that middle ear. If bacterial infections set up in the middle ear, it may no longer be air-filled. It may in fact be filled with bacterial infection and cause otitis media, which is an inflammation of the middle ear. Once our faces grow and mature, that auditory tube tends to become a little more diagonal. That makes it more difficult for infections to travel up here to the middle ear. There are also three little ear bones here. In fact, these ossicles are the smallest bones in the body. There is malleus, incus, and stapes. Alternately, you can call them hammer, anvil, and stirrup for their appearance. It is critical these bones do not fuse together, because it is their job to vibrate and magnify the sounds that we hear. So as sound waves hit against the tympanic membrane, those sound waves vibrate through malleus, incus, and stapes. And of course the sound waves should be louder by the time they reach our inner ear. Stapes sits on an oval window, which is the shape of the base of the stapes or stirrup. There's also a round window, but you can't see it from this picture. So here's another look at that middle ear area. You can see those three ear bones up close here. Malleus is the one that sits up against the eardrum. When the eardrum vibrates with sound waves, malleus vibrates against incus. Incus vibrates against stapes. Stapes vibrates against the oval window. Now in this picture you can see the blue structure is the inner ear, which includes semicircular canals and a cochlea. You can also see a round window there, which allows, unfortunately, bacteria to perhaps travel into that area and cause inflammation. So let's now turn our attention to discussing that inner ear structure. Let's talk about the inner ear now. There's two organs here to look at. The organ called the cochlea is a snail-shaped organ. That's the organ of hearing. This organ over here are called the semicircular canals. Okay, and there's three of them: anterior, lateral, and posterior. And of course these are for equilibrium and balance. Inside the middle portion of that vestibule structure that we just saw, there is a semifluid medium or gelatinous layer there. These are hair cells sticking up off of our neurons. There are tiny stones sitting up top here called otoliths. When you move your head, the hair cells are going to be bent as this gelatinous layer slides back and forth, and these otoliths go with it. When you move your head, you'll have a sensation of movement, even if you can't see where you're going, due to the activation of those hair cells and the generation of a nerve impulse. Here you can see the tiny little otoliths. They are calcium carbonate stones, and unfortunately, if they happen to break free from their location in the vestibule, they can give you a sense of constant vertigo or dizziness. There is physical therapy that can be done to put them back in their proper location and hopefully help to reduce that sense of constant motion or vertigo. Here you can see the semicircular canals. Those semicircular canals, of course, help us with a sense of motion. We call it rotational movement. So as fluids travel through those 3 semicircular canals, you have a sense for where your head is in space. If you've ever traveled on a merry-go-round and had a sensation that it was still moving after you got off, that's because fluids can still travel in the inner ear, and they have to come to a stop even after you've physically stopped moving on the merry-go-round. Just another look at that inner ear. Here you can see inside the cochlea, it too has hair cells that sit on top of a nerve membrane. When those hair cells bend with sound waves, those sound waves can then be generated into your brain. If those hair cells do not bend and generate a nerve impulse, you don't hear any sounds. And here you can see those hair cells inside the cochlea. They're part of neurons, and if those hair cells become damaged, then you can't hear. That forms a type of deafness called sensory neural deafness. And again, if you cut open that cochlea, you can see the membrane inside called the basilar membrane. That membrane is where those hair cells sit. When those hair cells bend over or get nudged with sound waves, that generates a nerve impulse, and then we hear some form of sound. Let's turn our attention to equilibrium and balance for just a moment. There's 2 types of equilibrium. Static equilibrium occurs when the head is not moving. So if you're just simply sitting still, that would be static equilibrium. Dynamic equilibrium occurs when your head is in motion. Imagine riding in a car and feeling your head move as the car accelerates. That's dynamic equilibrium. The information here is transmitted by the vestibulocochlear nerve. Do you recall the cranial nerve this is? This is cranial nerve, number 8. Let's erase that part. Okay, that's cranial nerve number 8. So both hearing and equilibrium are transmitted by the same nerve. Now, to be specific, like we were talking earlier, rotational movement is detected by your semicircular canals. That's like riding on a merry-go-round or a roller coaster, while the vestibule portion of the inner ear detects balance and head position. So, just to review, the semicircular canals detect rotational movement, like riding on a roller coaster or in a merry-go-round. The cochlea down here is for hearing, and the vestibule is this space in between. That vestibule, of course, includes types of receptors that help us detect balance and spatial orientation, basically where your head is in space. Both the vestibulocochlear nerve components transmit either balance and equilibrium or hearing back into the brain. Just a little information here on sound waves. The frequency and wavelength of a sound is called the pitch, and it's measured in hertz. The amplitude or intensity is the loudness of a sound, and that's measured in decibels. That information transfers us over to the top of page 133. And also on page 133, let's talk about the sound wave that travels into the brain. As sound waves are collected by the pinna or auricle, it then travels to the external auditory meatus. Sound waves first vibrate against the tympanic membrane. The tympanic membrane vibrates against 3 little ear bones, malleus, incus, and stapes. Stapes vibrates against the inner ear. So be sure to jot down the incus and stapes as the 2 answers for your worksheet. Those are blanks number 5 and 6. So stapes vibrates against the oval window. That's our connection to the inner ear. All right, so from the oval window in the inner ear, we can see that sound waves travel into the cochlea. Those sound waves inside the cochlea cause vibrations of hair cells, and the organ of Corti inside that cochlea will then transmit nerve impulses into the vestibulocochlear nerve. The more hair cells on that basilar membrane of the organ of Corti inside the cochlea that are stimulated, the louder that sound can be, and of course that sound wave can then be transmitted into the brain via cranial nerve 8. So cranial nerve 8, you may recall, is the vestibulocochlear nerve. It transmits both hearing and balance and equilibrium information into your brain. So here you can look at some of those hair cells. These are the hair cells sticking up here. And if those hair cells are bent or moved, then that can generate a sense of sound for the brain. If those hair cells do not bend, then there is no sensation of sound produced.